Understanding Childhood Eczema, a Parent's Guide. Eczema, also known as atopic dermatitis, is a common skin condition that affects millions of children worldwide. It is a chronic condition, meaning there is no cure. But don't worry, it is manageable with the right care and attention. Eczema is not contagious, so your child cannot pass it on to others. It is, however, often a source of discomfort and distress for both children and their families. This comprehensive guide aims to equip parents with the knowledge and tools they need to help their children navigate the challenges of eczema and achieve lasting skin health. Recognizing the telltale signs. Eczema symptoms in children. Eczema typically manifests as red, itchy, and dry patches of skin that can appear anywhere on the body. In infants, eczema often appears on the cheeks, scalp, and forehead. As children grow older, the rashes may shift to the creases of the elbows, the backs of the knees, and the wrists and ankles. The appearance of eczema can vary greatly from child to child. Some children experience mild redness and dryness, while others develop severe, itchy patches that crack and bleed. The itch that won't quit. How eczema affects a child's life. The persistent itching associated with eczema can be incredibly disruptive to a child's daily life. Children with eczema may scratch their skin incessantly, leading to further irritation, inflammation, and even infection. This can make it difficult for them to sleep, concentrate in school, and participate in activities they enjoy. The emotional toll of eczema should not be underestimated. Children with visible eczema may feel self-conscious or embarrassed about their appearance, leading to social withdrawal and low self-esteem. Unveiling the culprits, common eczema triggers in children. While the exact cause of eczema remains unknown, we know that certain triggers can exacerbate symptoms. Eczema, also known as atopic dermatitis, is a chronic condition that can cause significant discomfort and distress for children and their families. These triggers can vary from child to child, but some of the most common include environmental factors, irritants, food allergies, and stress. Understanding these triggers is crucial in managing and reducing flare-ups. Environmental factors like extreme temperatures, low humidity, harsh soaps and detergents, and exposure to allergens like dust mites, pollen, and pet dander can all irritate sensitive skin and trigger eczema flare-ups. For instance, during winter, the cold air outside and dry indoor heating can both contribute to skin dryness and irritation. Irritants such as certain fabrics like wool and synthetic materials can irritate the skin, as can fragrances and dyes found in clothing, soaps, and lotions. It's important to choose soft, breathable fabrics and hypoallergenic products to minimize irritation. Food allergies also play a role in some children, with common culprits including dairy products, eggs, peanuts, and soy. Identifying and avoiding these foods can help manage eczema symptoms. Parents should work with a healthcare provider to determine if food allergies are a factor. Stress is another factor, as emotional stress can worsen eczema symptoms. Children may experience stress from school, social situations, or even from dealing with their eczema itself. It's important to help children develop coping mechanisms for stress, such as exercise, relaxation techniques, and spending time in nature. Activities like yoga, meditation, and outdoor play can be beneficial in reducing stress and improving overall well-being. Section 5. The Daily Defense Moisturizing as your child's eczema superhero. Moisturizing is the cornerstone of eczema management. Regularly applying a thick, fragrance-free moisturizer helps to hydrate the skin, restore its natural barrier function, and reduce itching. Aim to moisturize your child's skin at least twice a day, and always immediately after bathing. Look for moisturizers that are specifically formulated for sensitive skin and free of potential irritants like fragrances, dyes, and alcohol. Section 6. Navigating the treatment landscape, from gentle relief to prescription power. A variety of treatment options are available to help manage eczema symptoms and prevent flare-ups. These treatments range from simple over-the-counter solutions to more potent prescription medications. The best approach will depend on the severity of your child's eczema and their individual needs. Over-the-counter remedies, such as moisturizers and mild hydrocortisone creams, can be very effective for mild cases. Mild to moderate eczema can often be managed with over-the-counter creams and ointments containing hydrocortisone. These are easily accessible and can provide significant relief. These medications help to reduce inflammation and itching, making your child more comfortable. However, for more severe cases, over-the-counter options might not be enough. For more severe cases, your doctor may prescribe stronger topical corticosteroids. These medications are more potent and can effectively reduce severe inflammation and itching. In addition to corticosteroids, calcineurin inhibitors, which suppress the immune response, may be recommended. These are particularly useful for sensitive areas like the face and eyelids. In some cases, oral medications may be necessary to control inflammation and itching. These systemic treatments can provide relief when topical treatments are not sufficient. Another effective treatment is wet wrap therapy. This technique involves applying a topical medication to the affected area, followed by a layer of wet bandages and a dry outer layer. Wet wrap therapy helps to hydrate the skin, enhance the absorption of medication, and reduce itching. This method can be particularly soothing for children experiencing severe flare-ups. By understanding and utilizing these various treatment options, you can better manage your child's eczema and improve their quality of life. Section 7. When eczema rears its ugly head, managing flare-ups effectively. Even with diligent care, eczema flare-ups can still occur. When this happens, it's important to take steps to soothe your child's skin and prevent further irritation. Give your child a cool bath or apply a cool compress to the affected area to reduce inflammation and itching. Avoid hot water as this can dry out the skin. Continue to moisturize frequently and use any prescribed medications as directed by your doctor. Resist the urge to scratch. Keep your child's fingernails short and consider having them wear cotton gloves at night to prevent scratching during sleep. Section 8. Eczema's sneaky sidekick. Recognizing and addressing secondary infections. Because eczema compromises the skin's barrier function, children with this condition are more susceptible to secondary infections. If you notice any of the following signs, it's important to contact your child's doctor immediately. Increased redness, swelling, or warmth around the eczema patches, oozing or crusting of the skin, pus-filled blisters, fever or other signs of illness. Secondary infections are usually treated with antibiotics. Prompt treatment is essential to prevent the infection from spreading and causing further complications. Section 9. Empowering your child. Tips for a lifetime of healthy skin. In this section, we will explore practical and effective strategies to help your child maintain healthy skin, especially if they are dealing with conditions like eczema. These tips are designed to be easy to implement and can make a significant difference in your child's comfort and confidence. Living with eczema can be challenging, but by taking a proactive approach to skincare and avoiding triggers, you can help your child live a full and active life. It's important to remember that every child is unique, and what works for one may not work for another. Therefore, it's crucial to tailor your approach to your child's specific needs and preferences. Establish a consistent skincare routine. Consistency is key when it comes to managing eczema. A regular routine helps to keep the skin hydrated and reduces the likelihood of flare-ups. Make it a fun and engaging activity that your child looks forward to each day. Make moisturizing a non-negotiable part of your child's daily routine, just like brushing their teeth. Choose gentle, fragrance-free products. These products are less likely to irritate the skin and can provide the necessary hydration without causing additional problems. Involve your child in the process of selecting their skincare products to give them a sense of ownership and responsibility. Opt for laundry detergents, soaps, and lotions that are specifically designed for sensitive skin. These products are formulated to be gentle and are less likely to cause irritation or allergic reactions. Always read the labels and avoid products with harsh chemicals or strong fragrances. Dress your child in soft, breathable fabrics. The type of clothing your child wears can have a significant impact on their skin health. Soft, breathable fabrics help to keep the skin cool and dry, reducing the risk of irritation and discomfort. Cotton is a great choice, as it allows the skin to breathe and doesn't trap heat. Avoid synthetic fabrics that can cause sweating and irritation. Encourage your child to choose their own clothes to ensure they are comfortable and happy with their wardrobe. Keep your child's nails short and clean. Long nails can cause more damage if your child scratches their skin. Regularly trimming their nails helps to minimize the risk of infection and keeps their hands clean. This will help to prevent scratching and reduce the risk of infection. Teach your child gentle ways to soothe their skin, such as using a cool compress or applying a gentle moisturizer. Be mindful of potential triggers. Identifying and avoiding triggers is crucial in managing eczema. Keep a diary to track any patterns or reactions that may indicate a trigger. Identify and avoid your child's individual triggers, whether it's certain foods, fabrics, or environmental factors. Encourage open communication. Talk to your child about their triggers and help them understand how to avoid them. This empowers them to take control of their own health. Create a safe space for your child to talk about their eczema and any challenges they may be facing. Seek support. It's important for your child to feel heard and supported. Encourage them to express their feelings and concerns. Don't hesitate to reach out to your child's doctor, a dermatologist, or a support group for guidance and resources. Remember, knowledge is power. The more you know about eczema, the better equipped you will be to help your child manage their condition. By arming yourself with information and seeking professional guidance, you can help your child navigate the ups and downs of eczema and achieve lasting skin health. Together, you can create a supportive environment that promotes well-being and confidence.